changing and improving technologies is occurring in all aspects of our lives, and it's important that neuromodulation systems keep up with that change.
I think digital technology for neuromodulation is just such an exciting concept, which I have always envisioned for my patients. And the fact that patients don't have to come in for reprogramming, for tweaking their programs, for understanding how the therapy can be changed based on their daily changes of pain. And they can get that done at their own time, at the luxury of sitting home, at work, or any other place they want to be. I think it's such an exciting concept.
So I feel that the ability to remotely program patients is transformative. It allows for so much more fine-tuning of these neuromodulatory therapies, which can be life-changing to patients.
Patients do better with more touch points regarding the neuromodulation system. And if this is able to be done without the need to wait on an in-person clinic visit, I think patients overall will do better.
I think the quality of life for my patients would be immensely improved by streamlining the control of their device onto their smartphone. I think this is because patients want to feel just like their loved ones, just like their friends, just like their families. They don't want to have to carry an additional device. They don't want to have to be different. They want to feel like their former selves or like their friends and their family. And they don't want to have additional considerations to just maintain the quality of life that they desperately seek.
Bring your own device is just another addition to that making you forget about your pain component, because you'll have your device you always have with you. There won't be a separate device you have to carry. And if you need to use that device to change something about your neuromodulation system, you can. If you're doing wonderfully, nothing changes. You put it in your pocket, you don't change anything, and you can kind of forget about the pain as well. So I think it's just the next generation of forgetting about your pain and becoming invisible therapy, if you will, because you don't feel it, you don't charge it, and now you don't have to have a special device in your pocket to program it.
I think having a platform where the patients can report and engage into daily will allow us to monitor and have more objective information as to the progress of the therapy. And ultimately what this will do is improve access to these therapies for patients from an insurance standpoint, because it will enable us to give this information to insurance and say, hey, their sleep pattern's better and their pain scoring's better. They noted progressive improvement with these activities that they've logged. Additionally, it will allow us to objectify a lot of the functional components that patients aren't able to self-report or delineate at the conclusion of the trial.
The NeuroSphere patient app will empower patients to take a more active role, because it's human nature. You know, I have 3 daughters and a son. My daughters will often compete with their Nike trackers on their activity level for a day and how much activity they've done, because they want to see their outcome improve and that they're doing well. Patients are the same. Patients would like to see themselves improve. So I think, the tracker will motivate people, if they're feeling better, to do more. And so to me, I think this will be a motivating factor for our patients to try to continue to improve the rehabilitation process.
I see digital technology playing a large role in patient care in the future of neuromodulation. I see this playing a significant role in getting the patients through a trial procedure, in particular the workup and approval process. But I also see it, more importantly, as playing a large role in ensuring long-term positive outcomes, in the fact of how we monitor patients over the long haul and even change their therapy remotely.
And if you think about it, what is that one thing which is challenging in managing electroceutical science on a day-to-day basis for our patients? It is staying in touch with them. It is having the patients play an active role. It is having the patients control their electroceutical device. And I think it is high time that we move to the next generation concept, such as NeuroSphere, so we can incorporate the new generation of digital health for our patients.